In this series, Beauty Times Medicine, we're exploring the latest innovations in dermatology, from injectable aesthetics and dermatological skincare to therapeutic breakthroughs, and how they're shaping the future of skin health. Joining us today is Dr. Stephanie Lam, one of the few Asian female plastic surgeons with global recognition in aesthetic medicine. Based in Hong Kong, Dr. Lam specializes in minimally invasive facial rejuvenation, body contouring, and much more. As a member of the Galderma GAIN global faculty, she played a key role in shaping the future of injectable aesthetic procedures worldwide. Dr. Lam, welcome to the show.
Happy to be part of the project.
How did you end up in plastic surgery?
Well, to be honest, I got into plastic surgery not for aesthetics at all. It's just that I was so fascinated really by the plasticity of the human skin.
I think early on you got involved in Galderma's GAIN, which I think is almost the best-in-class educational platform. You've been on the global stage, many cities, many conferences. How important is the whole GAIN platform for you?
I think the GAIN platform is really important for me because I feel it gives a high quality standard across different regions. Coming from Asia, I can tell you that for so long, each country are doing their own thing, some better than others. And when they talk to each other, they're not really in agreement. And so now that we have the GAIN platform, we standardize everything and making everything so much clearer. I think it gives a unified message to our consumers.
So when you look back or even look forward a little bit, with all the training you've been involved in, you've been hosting, I don't know how many GAIN events. How do you see the impact, particularly in JPAC, from all of these GAIN events?
I feel that in JPAC, the main thing is that, we've got one clear message and we've got a comprehensive platform as well that goes from actual tools like the facial assessment scale that doctors can use as a communication tool and an assessment tool for patients with the initial consultation and the subsequent treatment. I loved how we have then brought in the HITs, the holistic individualized treatment, which really helps doctor understand that we need to pay attention to treatment of the face as a region rather than as sum of its parts.
Of course, aesthetic medicine is rapidly evolving and more is getting into the practice. So specifically in JPAC, do you think, is it too much to say that GAIN has had a key impact in terms of efficacy and safety of procedures as they're rolled out and more start to practice aesthetic medicine?
No, I would not undermine the importance of GAIN at all, because when I go to the different countries, especially in the JPAC region, I have doctors coming up to me and say, I've never had this comprehensive training before where we talk about the whole face, not just a part, not just pushing the one product that we're trying to promote, but instead we've got a whole portfolio of product. And from my teaching, they really get to understand how to use an entire portfolio rather than whatever that the company is trying to push.
Turning to Hong Kong, if there's anything that's international, it's Hong Kong. So you have a lot of people with a lot of backgrounds, different skin types. So how does that impact the way you practice?
Well, I would say, of course, it's about respecting what my patients want. It's funny how initially when I started treating more and more Caucasian patients, some patients would come in and say, I'm not going to end up looking Chinese after injection by you, just to show, that they don't understand, of course. That's the common misunderstanding. But of course, for me, the way I teach and the way I really believe in this, our own beauty, it's all based on harmony and proportions. Even though our skin color, our bone structure may be different, but at the end of the day, it's about skin laxity, it's about skin quality, it's about proportion and balance. So I do take my time with the consultation and ask my patient not to rush into doing anything.
I've also heard you talk about the impact of traditional Chinese medicine. I think you even talked about your mom and the importance of what you eat on the quality of your skin. So how does that impact the way you think about practicing aesthetic medicine?
The Chinese medicine kind of thinking is we are what we eat. And I've been taught as a young girl that if I want my skin to be better, I have to eat these things that are supposed to enhance the collagen in my skin, which some of it sounds really funny, like sea cucumber, pig's trotters. These are all things. So certainly now when I talk to my patients, I also tell them about the importance of just generally staying healthy, the importance of taking certain supplements to enhance our health and enhance our skin health.
So, of course, also Hong Kong is associated with art, with pop culture, with film. And one of the trends that this next report that Galderma has put out talk about beauty fandom, that I see a style. I don't only want the same hairstyle, but I may even want the same facial expression. Is that something that plays a role in your practice? Do people come and say, oh, I want this particular look?
I do have some patients coming in with this beauty fandom trend, but as I find myself getting older, of course, my patients are getting older as well. So I would say the trends that fits most accurately within my patient is more the proactive aging and also the canceling age type of trend.
Are there any changes in the trends? Are people looking for natural beauty? Are they looking for an evolution over time? Because if you follow the patients for a long time, I'm sure you develop a plan with them. Is there any trends there to point out?
For sure. I would say, when injectables first came into the market, a lot of times patients are really looking for this wow effect, especially for Asians where, we tend to have a flatter nasal dorsum, we tend to have a shorter face. For sure, you want to have an injection in your nose, an injection in your chin to make your face conform more to the Western ideal. But now, as I continue along with my own aesthetic journey and my own career, I realized that in some patients, they want to keep those Asian parts of their face because that represents their true authentic self. So I feel that as I move along, I need to really spend the time to talk to my patient and understand what they're trying to get as well.
And if you compare to when you started your career and to now, are the demands put on you in terms of outcome? Have they increased? Are people more critical? They want immediate outcomes, or has that stayed the same?
People are always critical no matter what. But what I found is that because in my practice, it is more a word of mouth kind of referral. I don't advertise. I certainly don't pay any money on search engine optimization. So all of my patients come in through recommendations from a friend. And I found that through this word of mouth effect, when patients come in, they already know that I am somebody who is very thorough. I'm somebody who's always after the natural result. And I'm not afraid to say no to patients when they're asking me to do something that can make them look overdone or unnatural in any way.
It's been fantastic. So inspiring, and not only to watch you on stage, but also to be talking to you. And thank you so much. I think you do a lot for us at Galderma with taking part in the GAIN trainings, but I think you do so much for making sure that the rollout of GAIN and treatments are effective and safe. So thank you so much for that. It was a real pleasure to have you on the show. So we're glad you could join for this period of Beauty Times Medicine. We look forward to bringing you more insights and advancements from the brightest minds in dermatology. Thank you, and until next time.